Hi, good morning. So I'm gonna perform an easy pack therapy. So before we start the therapy, we always check the patient's chart, obtain any important information. Once on inside, we sanitize our hands, introduce ourselves, and then make sure we check the patient's ID band for confirmatory purposes. And then once done, we always have to reassess the patient, obtain any vital signs, make sure we auscultate and listen to their breath sounds. And then after that, we always have to include and explain it to the patient by telling them that this one is a non-invasive therapy. This will help open up their airways, clear up and mobilize their secretions, and also it will prevent their lungs to be collapsed. So this one is a device called AZPAP. So with this device, the flow is being amplified, and which creates a positive pressure that could help recruit and collapse the alveoli. So we always have to inspect the device for any cracks or damage present, and then make sure that everything is complete. And then we have two ports in here. The first one, which is the transparent, is where we're gonna hook up with the oxygen tubing. With this one, with the cap, is where we're gonna hook up with the pressure monitoring. So we always use this one during initial trials to check if the patient was able to tolerate. If we're no longer using this one, make sure this one is being covered. We don't want to expose it to ambient air. So and then when doing it, make sure that both of these are secured and tight, and hook it up in a flow meter. And then with this, make sure the patient is being positioned sitting upright, and then let the patient relax, and then hold it like this. They should not obstruct it in the back because it's not indicated to obstruct or block it. We can also use it with mouthpiece or mask as an option. So with the mouthpiece, make sure we have a nose clip to prevent the patient from breathing in through their nose. And then with the mouthpiece or the mask, make sure both of them are being secured or tight, no leaks present. And then with the mouthpiece, make sure their tongue should not obstruct the mouthpiece in here. So once everything's ready, turn on the flow. We initially start at 5 liters. We don't want the patient to reach more than 60 liters of inspiratory flow, just to prevent any complications. So allow the patient to take a slow deep inspiration. After that, let the patient take a strong exhalation, not a forceful one, and then it should reach about 3 to 4 seconds. So every after attempt, let the patient rest, and then let the patient cough. Take note of the color, consistency, and the amount of their sputum or phlegm. And then if we want to do multiple attempts, ideally we don't have to let it more than 5 times, not just to prevent the patient to hyperventilate, nausea, or even increase their intracranial pressure. We can also use this device together with a nebulization treatment, where there's a T-piece adapter in here, together with the specimen or the nebulization cup. So when using together with the nebulization treatment, this would benefit patients to restore or improve their lung volumes. So once everything is done, turn off the device, and then the manometer should be disposed because it's disposable. This one should not be soaked up with or immersed in water. And then make sure we cover it immediately. And then the mouthpiece, we can clean it with sterile water. So once everything is done, we always do our post-assessment, obtain any vital signs, make sure that we listen to the breath sounds if it's being cleared up. And then once we're outside, make sure we wash our hands, chart everything, document what we observe to the patient, and communicate with the staff.